Have you ever had a question that you would like a board-certified plastic surgeon to answer? Well, now you can. Welcome to this segment of Hey Dr. Soto, where board-certified plastic surgeon Dr. Armando Soto will answer your most pressing plastic surgery questions. Hey Dr. Soto.
Hi.
I had a breast augmentation surgery in 2001. I was not happy with the results as they were intended to correct an asymmetry problem, and that was not corrected. They are silicone implants. How long should I keep those implants for?
It's going to be hard for me to answer your question without seeing you for an exam because there's a few things that we would need to understand to answer it accurately and responsibly. I would want to know, is your asymmetry improved because of what was done earlier? Has it worsened over time since the surgery? What are the reasons that you're still not satisfied? And is it correctable, and is the procedure required to correct your asymmetry and achieve your goal going to be something that's worthwhile for you at this time? So the best thing to do in a relatively more complicated situation like yours is to come in and see me so that I can talk to you about exactly what's bothering you and what we need to do to make it better, and then talk to you about whether or not that's something that you would want to do.
Hey Dr. Soto.
Hey.
I would love to start looking sexy again to make my self-esteem better. I don't have much money, but is there any type of payment plan that your office offers?
Sure. We actually have several different financing options available depending on the surgery that we're going to do for you, how much that's going to cost, and how much of it you want to borrow, as well as what period of time you want to pay it off. The best thing to do is to get in touch with my office patient coordinator.
Hey Dr. Soto.
Hey.
I'm currently losing weight, but I really want a tummy tuck. When's the best time to do that?
That's going to depend on a few details that we probably couldn't understand without meeting and doing an exam, including how much overweight you still are, your motivation for further weight loss. In other words, I wouldn't want you necessarily trying to lose weight just so you could have surgery if your body's already at a fairly healthy weight. I've never been a big believer in there being a perfect weight for people, especially not a perfect weight to have surgery. What I think is better is for you to be at the healthiest weight you can be and maintain over the long term. That's really what's more important. As long as we're talking about 10 or 15 pounds. If it's more like 40 or 50 pounds that we would need to lose, then it becomes a safety issue. And the only way to understand these things again is for you to come in and visit with us. So come on in, we'll look forward to meeting you.
Do you have a question you would like answered on Hey Dr. Soto? Here's your chance to ask. Visit our Facebook page at Aesthetic Enhancements by Dr. Armando Soto, where you can post your questions that you would like answered and possibly see them featured on Hey Dr. Soto. Stay tuned for next week's segment of Hey Dr. Soto and keep those questions coming.